Hello and welcome to today's webinar. My name is Michael Kelly and I am the Customer Success Manager here at Mirketa Elixir. I've been consulting in the healthcare industry for around 5.5 years now, empowering healthcare providers with technologies that best fit their needs and overall process. We are currently tackling a very hot topic right now, which is MACRA, as the compliance leads to both positive and negative payment adjustments for all Medicare Part B claims. So it's become all the more important for healthcare clinics and providers to understand the process and stay one step ahead and be on that winning side. I want to go over a few housekeeping items before we get started today, mostly around how you would interact with us as the presentation continues. Firstly, if you wish to ask a question, please click the raise your hand icon at the top of the screen. We have enabled our ask a question feature, which is also, it's on the right hand side of your screen in the chat box. So if you have any questions, just feel free to pop them in there. And at the very end, we'll be running a live Q&A after the webinar has concluded. So if you miss anything, we'll be recording this session. So you can find that on our website within our resource library. We will also be uploading this to our YouTube, LinkedIn, and Facebook pages. So if something comes up that needs your attention, feel free to step out and we will find a way to get this over to you. If you experience any issues with today's webinar, please contact our support team at 1-800-647-5382. They will be able to assist you with any troubleshooting issues that you have. So now I want to introduce our speakers for today. We have Bhavesh. Bhavesh is our in-house health tech regulatory expert. He comes with 7+ years experience in the healthcare sector. He has worked with many EHR software development companies as well as healthcare providers to get the latest technologies implemented at their facilities. He's going to be tackling the basics about QPP, the MIPS program, and APM, and delve further into the eligibility criteria and the process for MIPS adjustment. We also have with us Ms. Neeta Kumari. Neeta is our product manager at Mirketa Elixir. She comes with a wealth of experience working with various U.S. healthcare providers. She has a total of 8+ years experience, I believe. Is that right, Neeta? In the healthcare and health tech sector. She's going to be talking to us about the easy steps that you need to follow to make sure you excel in the MIPS track and the checklist you need to follow to have everything in place. We're so glad that you guys could be here today to share your industry knowledge as it relates to this topic. So we're really looking forward to getting things kicked off. Myself, I am Mike Kelly. I have a wealth of experience in developing and selling EHRs to our U.S. healthcare providers. I've been with Elixir for almost 2 years now and will be primarily looking to answer any questions that come from the conversation. So without further ado, let's get things rolling. So the topic for today's discussion is focused on making your practice meet regulatory goals and start earning more money. We're going to discuss about the overview of MACRA, break it down into the reporting categories and requirements for each of those and how you need to be able to meet them. We'll also be breaking it down on how you initiate your claims process for MACRA. Most importantly, we are going to share the steps, the checklist, and steps required by your practice to make most of this new compliance requirement earn up to 9% of positive adjustment. The topic for choosing is not only applicable for healthcare providers who are going to participate in 2022 MACRA program, but also for the providers who may not be applicable yet, but can be moving forward. It gives you an overview of the process and shows you the step-by-step process that you would need to follow. And now I'm thrilled to hand the conversation over to our presenter, who is no stranger to Elixir webinar series. Bhavesh, you have the floor.
Thanks a lot, Mike, for the introduction. Welcome everybody to today's webinar. Now I know most of you would have already heard about MACRA, but I'm going to start by giving you an overview of MACRA so that you guys are reminded of how it's broken down, and then we are going to jump right into the things that Mike just described. So let's directly jump into this. So MACRA, although MACRA has had a bad reputation among providers, it is actually helping providers receive more Medicare payments because it did end sustainable growth rate or SGR, and it did help healthcare providers earn more incentives or payments as compared to the programs that existed earlier. MACRA's quality payment program is broken down into two tracks. One of them is MIPS, which is where majority of providers lie, and the other one is APM, that is alternate payment methods. Okay, Mike, next slide, please. Okay. So now we're going to talk about the alternate payment model. Think of this track as being the program under the MACRA program. These are commonly known in the accountable care organizations. And what are these? These are usually managed by local hospitals, local medical partners, etc. And what they do is that they invite local doctors or physicians to help improve the patient outcomes. Healthier patients in the community lead to Medicare spending less money, and that is why they really want providers to participate in these programs. And actually, what I see is that the Medicare or quality payment program is trying to push for APM rather than MIPS. That is because their real motive is to improve the quality of care delivered to the patient and create healthier communities across the country and lead to better patient outcomes. There are other programs that also fall under APM program. These can be specialty specific programs like neuro specific programs, or it can be state specific programs wherein a local entity asks local practitioners to participate. So the best thing you can do is either you or one of your providers can participate in community in accountable care programs and partner up with whoever invites you to join these programs. Find out what they are interested in, what they are working on. Most probably it will be quality metrics that they're working on, and usually these quality metrics can be tracked easily through Elixir's uncomparable reporting solutions. Okay, so now let's talk about the important facts about APMs. Again, these are Medicare programs managed by local medical entity. Most of them are accountable core organizations or ACOs, and the quality metrics are assigned to the clinicians. The quality metrics are similar to MIPS. Most of them have to do with controlling chronic conditions like high BP, monitoring patients with diabetes, breast cancer screening, etc. And these are the metrics that carry forward your weightage to support in the quality metrics. So if you have a provider working in these programs, make sure you guide them to selecting and recording the data in the Elixir's quality reporting. If you are a part of APM, you may or may not be a part of mix. Some providers do have a dual classification. They might be classified as MIPS provider and APM provider or both. So how do you know which category is for you? You need to check the eligibility description. That eligibility description will tell you exactly where you are eligible and what you need to work on. Every kind of APM has its own requirement, but it does give you the opportunity to earn more dollars than just MIPS. So if you check the eligibility and you have APM eligibility, then you can earn more incentive dollars than in any other program. Okay, Mike, next slide, please. Yeah. Okay. So MIPS. MIPS is merit-based payment incentive system. It is broken down into four categories: quality, promoting interoperability, improvement activities, and cost. Now, I like to specifically mention four categories because what I've seen in the industry is that most of the providers just focus on quality category and maybe like promoting interoperability, but most of the providers forget about improvement activities and cost. And you cannot just forget about them. You'll never be able to achieve the complete benefits if you don't work on all the pointers. I really say that why? Because the providers are only interested in those two categories because they have the reports running in for those two categories. While for the other two, they are not necessarily running the reports, so therefore they can easily be ignored. But here at Elixirs, we have solutions for each of your necessities that help you gauge the metrics required for each of the 4 categories and much more. Now let's focus on the eligibility part. Right, so eligibility has been same since MACRA started, which was in 2017. So if you're a provider, uh, if you're a provider, you need to have minimum 90,000 charged under $90,000 charged under Medicare. Now, if you're a provider, you already know this, but if you're a billing company, then also you should be aware about this for not just your facility, but to check, if your customers are meeting this criteria or not. So billable 90K under Medicare charges have more than, and you need to have more than 200 Medicare patients and render more than 200 professional services to those patients. That makes a clinician an eligible clinician. Now that the clinician or providers understand that they are eligible, you need to understand that there are still 4 categories. Quality has 40% weightage in your MIPS score, and it has to be reported for the full year. Promoting interoperability has 25% share. And again, Elixir has dashboard for those two, and it has to be reported anywhere between 90 days to a full year. Improvement activities similar to reporting has a weightage of 15%, and cost has a weightage of 10%. And it is evaluated, and the cost part specifically is evaluated by the Medicare on the basis of your Medicare Part B claims. The payment adjustments the payment adjustment for your MIPS program can range from anywhere from -9% to +9% of your Medicare Part B charges. Now it is important to know the threshold, because once you know if you're eligible, you need to know what you need to do. So the minimum performance threshold is 60 points. So what is the minimum threshold performance threshold? It means that the minimum performance you need to show to break even. No negative or no positive payment adjustment. You and your providers have to submit 60 points in your application. These 60 points give you the neutral status. And let me tell you for a fact that it is not easy. To achieve the neutral adjustment, you need to stay on track every single day in terms of your documentation. Later on, we will see how we can achieve this without so much effort, right? Now, if your practice has a goal to achieve a positive payment adjustment, you need to achieve minimum 85 points in your performance threshold. More than 85 points will give you an opportunity to achieve that positive 9% payment adjustment of your Medicare Part B claims. The submission options can vary by category. You can submit as an individual or as a group, depending on if you have different providers in your practice or if you're classified as a group practice. Now, the improvement activities may seem like a big gap, but it is actually the easiest category to achieve. It's the easiest 15 points you can earn. Now, cost is a full year analysis of your Medicare Part B claims. The thing about cost category is interesting because you won't know your score until the attestation. That means when you're trying to find if you're trying to find will the points will be 60 points or 85 points, you cannot take cost into account. So you try to come up with your 60 points using the other three categories. And if you do earn some points on the cost category, then it may get you a chance to earn some positive payment adjustment. But don't count on the cost points. So what's the process? The process actually starts by checking the eligibility. What I've seen many a times is that the practices start the process without actually checking if they're eligible, and later on they come to find out that they're not eligible. So make sure you check the eligibility. Next, participate in training. Connect with Elixir or other organizations who have expertise in regulatory compliance. Next, collect your data. You work throughout the year and make sure you collect the right data for reporting, and then you submit your data during attestation period. And hopefully you receive payment adjustment after that. So that's it, folks. That's the overview of MIPS program. Neeta, do you want to take it forward now and talk about the claim process?
I was hoping we actually might take a couple of questions here. Let me just look and see what we've got so far. Yeah, here's a good one. So my APM is not on the list of APMs. Do we participate in MIPS if this is the case? Yes, you do participate in MIPS to avoid negative payment adjustment. However, you may be in a different scoring system depending on your model. So I would contact your APM administrator to better understand the requirements. So for more information on this scoring for APMs you under MIPS and how it might impact you, you can visit the QPP website. Let's see if there's any others. Let's see. Yep. So is there if there is any advantage to is there any advantage to reporting advanced APM? Yes, if you are an advanced APM and you successfully report and are awarded the 5% bonus, the payment will be made as a lump sum bonus payment. All right, let's kick it back over to Neeta to continue for us.
Thanks, Mike. Can we switch to the next slide? Thank you. Now let's talk about the claim submission process, which most of you would be interested in diving into. The claim submission process can become your plan B if you have a provider in your practice who is not fond of technology and does not want to click and document everything in the EHR. Sometimes because it gets in their way, or they like using paper, or because they are so busy that they only want to do the bare minimum of just, running the practice. And when you run reports for those providers, they have a very low score. And despite how many times you remind them, they don't do the clicking and input those details. So for those providers, my suggestions would be submitting these quality metrics via claims. Now the risk is up to negative 9% adjustment. And if you help them submit quality metrics via claims, then you are, reducing the chances for full negative adjustment. Maybe they end up getting a 4% negative adjustment, which is better than getting 9% negative adjustment. So how do you do this? You go to the qpp.cms.gov. You are going to select quality requirements and scroll down on explore measures and click on it. There you can scroll down and select filter to filter your specialty or provider specialty, and then you can select Medicare Part B claim metrics. You're trying to find a code to submit via claims. Once you have the list, you can go ahead and select your top 6 metrics, or 8 or maybe 10 quality metrics that your practice captures. What you need to do next is to find the codes that you need to put in your Medicare Part B claims. Select Medicare Part B claims measures and click on PDF. This opens specifications for that measure. You can print it, you can save it. Now, what you're going to do is to start by reviewing the description and the instructions. Then you are going to scroll down to the part where you see the denominator description and understand how the denominator is calculated. Then you are going to scroll down to find the numerator for performance measures. Add the performance measures and you get the required codes. Now you can use them as they apply to your patient. My suggestion would be that the biller and the provider need to work in conjunction to make sure that those codes are applied in Medicare Part B claims for the necessary patients. And this has to happen for the entire year. Now let's next talk about how easily MIPS how easily it is to meet MIPS in few easy steps. As you know, understand the basics of MACRA. Mike, can we switch to the next slide? Yes. So we start by confirming your eligibility. This should be your very first step, not just to understand your eligibility for MIPS, APM, or both, but also you need to have a closer look at the description that they give you. And you do that by going to the app website, entering your provider's individual NPI. It only takes an individual NPI. Once you enter the NPI and check the status, you can see the description. First, you see the individual name, practice address, and you will see if the provider is eligible for MIPS, APM, or both, or if the provider is eligible as an individual or as a group. You will also know how they check the eligibility and how they reference the threshold. From there, you need to make a decision and ask yourself what your goal is. If your goal is to avoid negative payment adjustment, then you need to bring the score to 60 points. If the goal is to earn a positive payment adjustment, you need to submit more than 85 points. Next thing is to create a team which should include a provider, the clinical assistant, the office manager, and the biller. Earlier, clinical assistants or office managers used to play play a a greater role, but now we see is that the biller actually plays an equally or more important role when it comes to meeting the quality metrics or submitting a claim. So creating a team gives a sense of togetherness and common goal, and at least lets you break even. The next step would be to learn the program. Here you need to select your metrics and set the goals. Then share responsibility, like a clinical assistant is responsible for making sure that the vitals are updated, medication are reconciled, doctors make sure that the problems are measured. A common mistake that a doctor is that the doctors don't add a start date when they are adding a problem. CMS looks for a start date on some quality metrics for the problems, depending on who is responsible for what, and holds them accountable. Uh, my recommendation is to run your reports every 2 weeks, because it gives you enough time to see if something is not going right, the points are not increasing, then you can address it right away instead of waiting a month to notice something and apply a fix or change the workflow. If you are closer to the end of the year, then let's do it every week. Now, how Elixir helps you is by providing you with expertise in the process and program, and sitting with you to make sure your attestation is done the right way. You have your own in-house experts who take constant meetings and webinars to help you through the entire process. The best thing you do right now is to reach out to us and let us know, and we'll help you through it. For helping our partners, we have a step-by-step guidelines and short videos which are easy to read and understand. It tells you what you need to click and when you need to do the clicking. Step 3 is to track your progress. This can be done weekly, which is the best way to go about it. You can see your performance, the numerator and the denominator. You can also see the national average and compare as to how you're doing. So, your goal always should be to do better than the national average. It's not necessary to achieve 100, but it's better to be above the national average, as it gives you better chances of earning a positive payment adjustment. There can also be inverse metrics where you need to lower the scores as much as possible. For example, the BP poor control, you cannot have poor control. You want to have zero poor control. So your goal here is to hit 0%. Elixir gives you these reports to have a better understanding of your processes. There's also interoperability report, which tells you how you're doing on e-prescription, inviting patients to the patient portal, referrals, etc. It's about documenting everything correctly. For either report, identify areas that need improvement and check the guides for improving them. If your scores are not yet aligned with your goals, connect with Elixir Consulting and we'll figure out a way for improving your processes so as to, improve your scores. And repeat these steps every 2 weeks, of course. Now that you have worked on reports and metrics, it's time to start collating everything for attestation. Create an binder or an audit folder. I recommend you do it both ways, in hard copy or soft copy. This is only for emergency in case something happens. For saving the soft version of these reports, since it's available on Salesforce Cloud, so there are no security concerns. You can access them anytime and anywhere. In the binder, you are required to store security risk assessment. It's the first document that an auditor would ask you to submit. Save report supporting documentation for your selected improvement activities, as we discussed. Improvement activities are an easy way to grab those extra points. Also keep copies of your final reports, that is, if your quality metrics which you're going to save in XML report, and you can easily download it from Elixir Reports tab. Also save the promoting interoperability final report in PDF format, and of course print a copy. Have all that and you will have a peace of mind that you're good to go. The last step is to attest your data. Make sure everything is billed, all the claims are submitted, all the notes for the previous years are signed. For attestation, you are going to need your EIDM or HARP login credentials for the qpp.cms.gov website. Have that ready. If you don't have one, go to the attestation website and register. Log into the attestation website and submit your MIPS data. Once you submit the data, you will see your preliminary score according to the documents that you submitted. but the final score will not be revealed until after the attestation deadline, which will then include anything that you scored in the cost category. So that is about the steps to meet the MIPS criteria. Mike, next slide, please. Thank you. So as we see, there is no need to be worried about MACRA. It's all about being prepared, and that is the best thing you can do. And for you, we have summed up our entire discussion into a checklist that you can just follow to make the most out of the MIPS program and achieve your desired goals. The first thing you need to do is to check your eligibility for MIPS or APM program and decide on individual or group reporting. Small practice providers have the option of reporting individually or in a group. You also need to be in line with your EHR vendor. Your EHR vendor can be your partner in simplifying MIPS and reducing your workload in tracking and documenting performance measures. Look for an EHR like Elixir that automates and simplifies the data collection and tracking processes so that you don't have to worry about additional workload. If you want to achieve the maximum benefits, you need to make the right plans since the beginning. To earn the most points and receive higher positive adjustment, quality and cost measures need to be collected for the entire year, promoting interoperability and improving activities category for at least 90 days. You also need to select your reporting categories from your EHR, and you need to conduct a security risk assessment to ensure security of your patient data. If necessary, you need to make changes to your process to enable data collection as required by MIPS. This is where Elixir shines. Elixir's easy to use system is fully customizable according to your needs, and higher Salesforce capabilities provide Elixir with unparalleled reporting capabilities. You then need to use these advanced reports and dashboards to constantly measure your progress and make improvements whenever necessary. Then create a digital and hard copy audit folder to store the information in support of your MIP submission. Complete your folder before you attest, and the data must be kept for 6 years. Finally, select your submission method or hire a registry and create your HAP login account. It is important that you keep a copy of your submission acknowledgement in your MIPS audit folder. So that is it. Now you're ready to achieve your MIPS goals.
Well, thank you, Neeta. That was very great. I really enjoyed listening to your insights there. Let's see if we have any more questions here. Um, let's see here. What help is available for small practices for achieving success in the MIPS program? The CMS has allotted around 20 million a year to provide technical assistance to practices with 15 or fewer eligible clinicians participating in MIPS. You can go to the website as mentioned in the chat and help find your area there. Unfortunately, that's all we have time for today. Thanks for joining us and submitting your questions. I want to thank Neeta and Bhavesh for doing such a great job and taking time out of their day to present to us. I also want to give a brief synopsis on our Elixir product. Elixir is the world's first practice management suite built on the world's #1 cloud and CRM solution, Salesforce. Elixir's practice management suite is a comprehensive solution consisting of 4 modules that fit tightly into your healthcare business, irrespective of your facility size and type. Whether you're a multi-site or multi-service provider, we are here for you. The Elixir Contact Center module helps in managing the entire facility census and the patient intake process. At the same time, the Elixir EHR solution aims at delivering an end-to-end seamless patient care experience. The third module is Elixir RCM Billing, and it effectively fetches data from any EHR platform to process medical claims and manages the entire revenue cycle. To combine it all together, we have our Elixir Patient Portal, which is our last module. It enhances your patient engagement and provides an integrated experience for your patients. Thank you again. If you'd like to speak to us further or reach out for collaboration, please drop us an email at info@elixir.com, or feel free to call us at 1-800-REMOTE 647-5382, and we'll reach out to you shortly. We'll upload this full recording, as I stated at the beginning of the webinar, to our Elixir website at elixir.ehr.com, or you can find it on our social media pages of LinkedIn, Facebook, and YouTube. So keep an eye out, and we hope to see you at the next webinar. Thank you.